My name is Tara Schweitzer. I'm a National Account Director for our Managed Markets Division here at Boehringer Ingelheim. It's my responsibility to call on a large national payer and make sure that they are aware of our products, diseases in which we treat, and to make sure that the patients that are insured by that payer have access to our products.
My name is Tammy DeRuin Canfield. I am currently working on a pilot here at Boehringer called the Account Medical Advisor. This is a new role for us here, and it really is serving a purpose of providing a face of medical for our managed care customers. So we're partnering with our internal colleagues and really being a part of the account planning process. Up until now, I would describe medical's role in these accounts as reactive. The pilot is allowing us to be proactive. We're really a part of the account team, and we're able to develop relationships with these customers that they know that we're the face of medical for them.
I would say from an account management perspective, the evolution of this pilot has allowed us to be more responsive, more real-time focused. Just as Tammy mentioned, when you are reactive, you lose a little bit of time. And so there is a lag sometimes between a customer's question or need and our ability to respond to that need. So in the evolving role now with the pilot, we are able to bring real-time resources directly to the customers right when the question's asked, right when the need surfaces. And that to me shows that Boehringer is being very responsive to an evolving marketplace, and it provides a higher level of value to our customers.
One of the insights that I have recognized is we were meeting with the medical director at the national account. He's not only a medical director of the account, but he also serves on the formulary decision-making committee. So we were introducing the role of the AMA, and I explained one of the objectives of our pilot is to really have payers involved earlier in the clinical development of our products. So for instance, what outcomes and secondary endpoints they would be interested in seeing. We really want to make sure that once our products come to market that the payers are going to want to be part of that and want to make it have access for the patients. So I explained that we have products currently in psoriasis and Alzheimer's, and he stopped me right there with Alzheimer's and said that he was very interested in being a part of that and would offer data from his account to give us some insights.
And that adds a tremendous amount of value because frankly we would not have had that conversation if Tammy had not been with me on that appointment. It's not a conversation on the commercial side that we're able to have. So it just gives an example of the opportunity to take a 30-minute appointment and turn it into a longer period of time with a very important customer and to bring information into BI that we would not otherwise have had access to. With the large national payer, we've actually been able to take an appointment that was 30 minutes in time, scheduled for 30 minutes, and make it an hour. We actually had an audience there of 12 clinical pharmacists. In the past, honestly, we might get one or two, and then the conversations were very specific to current drugs on the market today and current needs today. But after they understood the role that Tammy could play, they actually invited their pipeline team, their trend team, and their clinical formulary team to our meeting, and we were able to discuss a variety of topics, not only today's current products, but also pipeline conversations that Tammy is able to discuss that I would not have been able to discuss had she not been there. So we really were able to grow our breadth in the account and really take the time, make the time longer, and make it more valuable.
We've also started with developing a relationship with this account. The pharmacists that were at the meeting have actually reached out to me directly and asked other questions, follow-up from the presentation.
I think it's important that BI recognize and be very proud of the work that went into developing this pilot. This was a very cross-functional project team looking across commercial, medical, legal, regulatory, compliance. I think there were a lot of folks that put their heads together to help BI be more nimble, to look at the marketplace, how is it changing, and how do we be more responsive to our customers. So I think certainly want to acknowledge all the work that's gone into getting this pilot to the customer. And I think what we've demonstrated to the customer is that we are more agile. We are responding. We are paying attention to what the world is now, and we're providing resources in real time.
We're adapting, and we're doing this quicker and more efficiently and smarter. It's really not just a nice thing to have, it's something we must have.